A pandemic is a horrifying term. We are conditioned through movies, books, and history to know it means disease, death, and panic. I mean, the word pandemic literally has the word panic in it. But what exactly is one? How is it declared? And what happens if there is a pandemic? Hello, my name is Franciscus Elino. So today I will explain to you what is pandemic and how to be prepared in that situation. So, in order for a pandemic to occur, it needs to start with an outbreak. If we look at the disease COVID-19 outbreak occurred in Wuhan, China, from the SARS-CoV-2 virus. A viral outbreak requires a new virus that humans do not have immunity to that is able to infect human, cause disease in humans, and spread from humans to humans quite easily. If the disease spreads within a initial community or a specific region or country, it's called epidemic. Surprisingly, for something to move from being epidemic to pandemic, there is nothing to do with the severity of the disease, but rather its geographical spread. The exact definition varies within organization to organization, but in general, if a virus begins spread across international borders and around the world, only then is it considered a pandemic, but actually isn't that simple. If you contract COVID-19 in China, but then went home to Indonesia and spread it to someone there, it doesn't count as crossing international borders. It becomes pandemic when people start to getting infected by people who have no traces to the infected countries or the initial epidemic center. An example of this community spread when someone gets the disease, but the source of the infection is unknown. It might help for us to look at historical pandemic. Some of this pandemic actually happens thousand years ago. For example, Antonine Plague, which happens to the Roman Empire when troops returns home from the east. It estimated this pandemic killed 5 million people across Greece, Italy, Egypt, modern day Turkey. We don't exactly know what caused the pandemic, but researchers think that was a smallpox. Then, of course, you have perhaps the most famous pandemic, the Spanish flu in 1918, which actually named so because it started in Spain. It's believed that it may have originated in army camp in Kansas, and which is was then brought to over Europe by troops. But it's named the Spanish flu because Spain, a natural country during World War One, openly reported on its a cure while other countries censored or tried to hide it. This time, 500 million and estimated 15 to 100 million died, which was more people than World War One killed. What was perhaps the scariest part was that it actually had a second wave in October. So the first affected people who the first wave affected people who were primarily elderly or really young or sick. But and the second wave actually have affected people between ages 20 to 40 severely. Interestingly, the war is often considered a contributing factor. Not only because troops were moving around the world with improved transportation and technology, but soldier were actually more prone to getting the flu because stress, malnourishment, and chemical attacks. But just as fast as the Spanish flu hits the worst point of it, it quickly died out. After the peak of the second wave in October place went from having 1,000 of deaths to none. One theory suggests that the virus actually mutated away from its small little strains as people died out with those little strains. All that was left over was more mild version. But now in our modern world, when does a pandemic get official declared? We look to agencies such as the Central for Disease Control and Prevention, the World Health Organization, or the European Central for Prevention and Disease Control to declare a pandemic. But different scientists, epidemiologists, or a collective could technically declare one based on their own judgment. You may think this would be an easy decision on what once it act like a pandemic, call it a pandemic, but these viruses these viruses are hard to trace, especially if their disease has a long incubation period or cause minor symptoms leaving a diagnosis untraced. There are other issues with claiming a pandemic as well. For example, the WHO came under a lot of scrutiny in 2009 when H1N9 virus was declared a pandemic. This is because it led to some unnecessary panic and a lot of countries end up spending money to develop a vaccine for the flu when they end up being fairly mild and easy to contain. Official classification of pandemic by institution depends on the variety of the factors, but, but surprisingly, it's simply a label and actually has no legal implication. The WHO has declared COVID-19 a public health emergency of international concern, which is many ways is more important. It allows them to start making recommendations to members countries on how to handle the disease, also how to mobilize funding and political support. But when a pandemic is declared, it doesn't mean the disease has spread to many countries around the world, and that's significant. We obsess over the world because it holds power. Declaring a pandemic could cause unnecessary panic, which has many downsides, but on the other hand, it could also allow citizens of the world to mentally and physically prepare to for the spread of the virus and disease might actually help with the medication. There are pros and cons to the declaration of pandemic, but that brings us to the next question. What do you do then when organizations start declaring a pandemic? So, first, first off, you need to listen to healthcare professional. They are on the front of line of this situation and prepare to work with epidemiologists, researchers, and scientists to effectively curb the disease. Be wary of unverified exaggeration and disinformation online. Again, if one is declared, nothing will legally change, but naturally people will act accordingly. Hospitals around the world will become the front line of defense, putting the sickest first, uh, and postponing unnecessary surgeries and appointments. Hospital will also extremely busy, so household, business, and communities will also need to work independently to decrease spread. Social isolation will become more normal, and mass gathering will be cancelled. So that's all for me. So I hope this message will be useful for your life. Thank you.